I majored in biology. I loved science. My mom was a high school biology teacher, so I think I grew up with that at home, and I always enjoyed the life sciences. Well, I always knew I loved infectious disease. I had the opportunity to do a couple different internships in microbiology labs during my undergraduate training and in medical school, so I knew I loved infectious disease. And so I tried on lots of other specialties, but ultimately I kept coming back to infectious disease because I was just fascinated by it. I think bacteria and viruses are really interesting. That sounds so nerdy, but I just think that it's amazing what they can do and how much they've shaped history and politics and a lot of our culture. And so I enjoy the history of medicine, and there's a lot of infectious diseases within that. So yeah, I'm a nerd. I just really think bacteria and viruses are super fascinating. I get a lot of gratification from watching people get better. I think that's the biggest thing. Is I love getting to know people. I meet a huge variety of people from all different walks of life. I enjoy that. I enjoy hearing people's stories about where they grew up and how they grew up and where they've been over their lifetime. But I really enjoy getting to know them. And then ultimately in infectious disease, the majority of our patients are going to get better. And it's really gratifying to see that and help them on that journey. I would say generally I'm pretty informal. I like to joke around with my patients. I like to have a good working relationship with my clinic staff so that we've got an effective team, but really, we want to make sure that everybody on the team can come together and just provide really high quality care. One of the things I love most about my job is the huge variety of things that we see. Everything from people who are living with HIV infection or hepatitis B or hepatitis C, which are potentially chronic viral infections, all the way to people who may have had an injury and have a bacterial infection associated with a wound or things like that. So we see a huge variety of different problems related to infections. I think the biggest thing, and it was really apparent to me throughout my process of getting to know Avera, was that the focus was really on doing what's best for the patient and what's best for the community. And I think we all see that in healthcare sometimes that gets lost. And so I think that really aligns with the care that I want to provide is, for the person in front of me, how can I best help them meet them where they're at that moment? And that was what I heard over and over again as I got to know Avera. So I'm really looking forward to that mission. I like to be outside. That's probably my number one. If it's outside, I typically enjoy it. I really like to hike and bike. I have a 9-year-old son, so anything that we can get outside and do as a family. I like to cook and read as well.